Hi, Jennifer here with Dr. John Corey. I'm here to talk to you today about the differences between saline and silicone. You can read so much out on the internet. We all have got girlfriends that love one, that's going to push us to one or the other. But really, I love education, and I love educating our patients when they come in about the real pros and cons of each. Dr. Corey believes that it's more of a science. It's more of a science because we match that implant to your body, meaning we measure the base width diameter of your breast, the area between nipple and nipple, between the clavicle down to the nipple, to look in differences in sizes to match one specifically to your body. But today we're going to just talk about the differences, similarities, so you have a little bit more information. So we're going to start with the saline implant, and then we're going to talk about the first generation gummy bear implant, our silicone smooth round gel implant, and then we're going to talk about our second generation gummy bear implant, which is the Allergan Fortin. We are an Allergan facility. Allergan owns Botox, Voluma, Juvederm, Latisse, huge company, and really the best warranty in the industry. So we're going to talk about that today as well. But starting with our saline implant. I don't have this one filled at the time, but the saline implant is a silicone rubber outer shell, sterile saline on the inside of that implant. It comes rolled up from the factory, so the incisions are a little bit smaller. It's placed in the breast cavity pocket that Dr. Corey will be making for you, either above or below the muscle. Most oftentimes we go behind the muscle because it gives a little more natural look. And then this is filled intraoperatively. So what we love about this implant is that it's very minutely tweakable. You can fill this up, set the patient up in surgery and say, you need just a little bit more on this side, and then we will lower you back down and we can tweak that there in surgery. So great benefits. Also, one thing that we love about saline implants is that it is overfillable. So you can take a saline implant and you can put a little bit more volume in it later on to give you a little bit more of a lift, a little bit more volume to the breast without having to change out that implant if you're kind of on the fence early on. Some things we don't love about saline is that if you're really ultra thin and you don't have a lot of breast tissue, then it actually can get some of rippling around the sides of the breast to where you can see that implant bag, and that's not super attractive. So Dr. Corey would probably not recommend that for you if you are an A- breast or 5'9", 100 pounds. So we would probably recommend going to a silicone, which we're going to discuss now. Our first generation silicone is not that syrupy silicone of the past that was taken off through the FDA for many, many years ago. This one has been out now. We're coming up on clinical trials with a 10-year period. We love this implant. Probably 85 to 90% of our patients love this implant as well. It can be placed through any incision site, so transaxillary, which is under the underarm, inframammary, underneath the breast, or areola, going around the areola. We can place it through any location. And when I talk about this implant, I'm going to say gummy bear because really it's that consistency. It's a large molecule silicone. This feels so natural and soft like real breast tissue inside the body. So for someone who previously has had a saline implant, wanting to come in to get a breast implant exchange, oftentimes they'll move up to a silicone implant. Our new data on this shows the rupture rate is only about 6% in a 10-year period, so very low. Longevity on our implants, Allergan says 10 to 12 years, but we believe that these new silicone implants are going to be lasting much longer than that. If they don't, that's when the warranty comes into effect, which we like to talk about with all of our patients. Dr. Corey never wants his patients walking around with a problem with their implant. Should you have a break rupture or with saline implant deflation, Dr. Corey will take you back to surgery and waive his surgeon's fee for replacing them for you. Allergan, as a facility manufacturer, they warranty their implants for a lifetime. So should you have a problem, they will send us a brand new pair, not just the one you have the problem with, to replace those out for you as well. And lastly, if you do a silicone implant, so one of our two that we're talking about today, and you have a problem with that implant, break, rupture, or deflation in less than 10-year period, Allergan also gives money towards surgical and anesthesia costs, so there's not an outlay of funds there. So really phenomenal warranty. But really, the most important is safety. Every day I have patients asking me, is silicone safe? Am I going to be okay putting an implant in my body? And the FDA, as well as many, many other researchers, have shown that yes, they are safe. So that's good. Not linked to cancer, thyroid disorders, autoimmune diseases. So we're not putting anything in your body that's going to be damaging to you. Secondly, we're going to talk about our Allergan Fortin implant, and this is they're marketing now as the gummy bear implant, but we really know that it's more the second generation gummy bear. And the reason for that is it's more cohesive. It's a firmer consistency. You can cut this implant down the middle, hold it upside down. It will not spill out into the tissues. And it's a teardrop shaped, so it's anatomically correct. A textured covering or coating on top of the implant, and it's placed directly where we want that implant to sit. So we place it through the inframammary fold, and it goes directly where we want that to be. Love this implant. It is great for those patients who are a little older, have had capsular contractures in the past, or for our really ultra thin patients that would see a ripple or a wrinkle with any other implant. This is the implant for you. So moving on, there's a big, huge myth out there that you have to get your implants changed out every 10 years. I actually, as an RN, thought that many years before I worked in plastics, and that's just really a myth. Dr. Corey will tell our patients, if you look good and you feel good, then you're good. So wanted to let everyone know that that doesn't happen. As long as you look good, then the longevity of these implants can go much longer. I'm Jennifer from Dr. John Corey's office. I would love to talk to you about implants. Give us a call. I'm happy to help.